Hi, my name is Joseph Abraham. I am a PGY2 at Unity Health, Jersey, Arkansas. Today I'd like to present this very interesting piece under the name LAD, not PUD, Case of Missed Wellens Syndrome. LAD stands for Left Anterior Descending Artery, and PUD is ulcer disease. So our patient is 61-year-old lady, came to our emergency department complaining of severe chest pain. He graded as 9 out of 10 in intensity, and it was radiating to her left arm, also associated with shortness of breath. He had positive family history of coronary artery disease. She was complaining of the same pain as severe for quite long time, and she had history of multiple visits to other emergency department. All of them diagnosed her with gastritis or peptic ulcer disease and gave her antacids and omeprazole 40 milligram. In our department, when she presented us, her EKG as kind of flat to biphasic P wave in V1, V2, V3. As we can see here in EKG, V1, V2, and V3 kind of flat or biphasic. Her previous EKGs looks the same. Also, she had kind of poor R wave progression, also in V1, V2, and V3. Her troponin evaluation in our department was 1.250, which was positive. She was diagnosed with non-STEMI, and she was started on the guideline-directed medical therapy for non-STEMI, and she was taken to the cath lab. In the cath lab, there was long LAD lesion with minimal post-flow, like TME1 grade 2 flow post-lesion. So the operators start to go ahead and wire this lesion and ballooning, then stenting. After that, it was successfully regained a TME3 flow in the LAD. Wellens syndrome is not a rare finding. It's well known among cardiologists, but it's rarely known by emergency doctors or internal medicine doctors. So the moral of this case presentation is to raise the awareness of this sign. So if we have a patient with severe chest pain, positive risk factors for cardiovascular disease, elevated troponins, or not even elevated troponins, with biphasic P wave in V1, V2, V3, that could be Wellens syndrome, which denotes critical mid-LAD lesion. You could save the myocardium and the life of this patient if you recognize this pattern of Wellens syndrome. You could save this patient his life if you could catch the sign early. Thank you.